All right. So Dr. Christine Maren, so glad to have you here with me today, and welcome to the Mastering Blood Sugar podcast. How's it going?
Thank you. I'm so glad to be here.
Yeah. So I
talking
know,
about blood sugar.
Yeah. We were just talking, and you are going to be relocating your practice to Colorado soon. And actually, by the time this airs, you'll probably be in Colorado, which
I
is
will
fantastic.
be home. Yep.
Yeah. So that's great news. And where are you right now?
I'm in Michigan. I'm in Birmingham, Michigan. We're here for a year. My husband's a physician also, so did his fellowship here. But yeah, so my practice is here in Michigan, but relocating to Colorado, and I'm licensed in Texas as well, so I have a lot of patients there. But I'm going back home to Colorado after a long time being gone, and I'm super excited. My whole family lives there, so it'll be good.
Right outside of Boulder.
To help with all of my children.
Yeah, exactly.
Yeah,
Excellent.
right outside of Boulder. So,
well, I want to talk to you about gestational diabetes today.
Yes.
It's a big topic, and I don't think it's enough discussion around it because it's so important. And I think it's for women suffering with gestational diabetes or dealing with it. It can be quite scary, and not only scary, it can lead to type 2 diabetes down the road and other problems, potentially problems with the baby. So let's dive in and talk about this. The other thing is, I think, because of the nature of pregnancy, it's easy for women to get intimidated and scared and just want to follow exactly what their doctor says. Yeah. And so I want to bring your insight in here as a practicing physician and someone who's dealt with this. So could you maybe share your story first so we get a little background?
Yeah, absolutely. And I love what you said. I mean, exactly. During pregnancy, it can be a very scary time for a lot of women. And you're pregnant, and like, who are you supposed to listen to? And you need to know now, right? You have this baby growing inside of you. And I understand that there is this a sense of urgency because I've been there. But my story, as I was saying, like, I grew up outside of Boulder. I was sort of like just used to this very natural approach to medicine and healthy living, and went to an acupuncturist when I had issues with my hormones or whatever. So I grew up with a very holistic sort of background. But I went to undergrad in Boulder, and I went to medical school. I decided, I was going to go to medical school but be a holistic practitioner. And part of what brought me into functional medicine was really my experiences with pregnancies. I realized that acupuncture wasn't enough for me, and that I really needed to delve deep and figure out what was really going on at this, just root cause medicine. So it started really with gestational diabetes. With my first pregnancy with my daughter, I was diagnosed with gestational diabetes. I mean, I was a super normal weight. I had no risk factors you could think of. So it was pretty off the wall. I was surprised. And at that time, I was a resident in San Antonio. So like all of my patients had diabetes, but they were very different. They were, they had a strong family history of it, and they had all of the risk factors. I didn't. And so that really caused me to sort of look deeper as to what was going on with my health and why I was having this reaction. But I also learned a lot about nutrition, and I got really interested in foods and what those did to your blood sugar. And so it's very empowering in a way, and led me down a pretty specific path. But it was interesting because when I was diagnosed, I received a lot of medical advice and had an appointment with a dietitian. And luckily, I was equipped enough to know that the advice that I was given was not going to be to my benefit or to my baby's benefit. And I sort of went on my own path of figuring out, like, what do I really need to do? What do I really need to be eating?
What was some of that advice that you were given that at that time even you realized was maybe not the best advice?
Yeah. So high carb, whole grain diet. Of course, they recommend against eating sweets and cake and sugar, but starting my day off with oatmeal was not the way to go. I mean, that was definitely something that would spike my blood sugar. I think the whole grain advice is very confusing for a lot of people because they think, oh, whole grains, okay, I'll eat whole wheat bread instead of white bread. But really there's no difference to your blood sugar. As you know, it's like totally negligible. So that was a big piece. I mean, essentially the advice you get when you're pregnant is have about 50% carbs, but low fat. So what are you supposed to eat, right? So like if you're not eating a lot of fat, you have to replace it with carbs. I mean, obviously there's protein in there, but I pulled up some recommendations. Actually, I want to read these because they're kind of scary. So one of the recommendations from familydoctor.org, actually, sadly, because I'm a family physician, but it says if you get hungry between meals, eat foods that are healthy for you, such as raisins or a piece of fruit. Whole grain pasta, whole grain breads, and rice are also good for both you and your baby. And that's in reference to gestational diabetes, right? So it's like, no. I mean,
Wow.
that's not, that's what spikes your blood sugar. So during my pregnancy, I learned, I went to the pharmacy and got my glucose strips and my lancets and figured out what that was about and monitored my blood sugar at least 4 times a day for like literally 6 months. So I watched it like a hawk, but I learned about exactly what those foods do. And I think, self-monitoring blood sugar for pregnant females, specifically those with blood sugar issues, is really empowering because you get this immediate feedback as to what certain foods are doing. So
gestational diabetes is diagnosed with a oral glucose tolerance test, typically.
Yes. Yeah.
And if you have gestational diabetes, you're found to be intolerant to glucose. In other words, you don't tolerate glucose well. Yet the recommendations are to start your day with a bowl of oatmeal, which has 70 grams of starch, essentially, which is just long chains of glucose. And then if you get hungry between meals, you're supposed to eat more glucose and make at least half of your diet sugar, which is a combination of glucose and fructose, but a lot of glucose in there. So for somebody who's tested and shown to be intolerant to glucose, why do you think the recommendation is to eat a lot of glucose?
I don't know. It's super weird, right? I mean, if you look, online or in medical literature, the other word for gestational diabetes is carbohydrate intolerance. But they're like, a lot of people say, but you need to eat a lot of carbohydrates. So I know one of the underlying reasons is because any pregnant female knows every time you go to the doctor, you get your urine checked. And when they check your urine, they're checking for ketones. Ketones would indicate not enough caloric, or could potentially indicate caloric restriction, and ketosis for different reasons. Some of us go into ketosis purposefully, not during pregnancy generally, but a ketogenic diet, high fat, low carb, that sort of thing. So, I mean, there's definitely some argument about that, and testing urine strips for ketones certainly don't correlate with serum ketones. But I think that most of that recommendation comes from keto strips or from, monitoring for ketones in pregnancy. And I don't know, honestly. I mean, I think, look back at all of our dietary recommendations. I mean, I think the gestational diabetes recommendations are even further behind the recommendations that we see for a normal population.
Right, because it's the ultra conservative.
Yeah, like go back to the food pyramid and don't change it for several decades. And
right,
I think it just archaic, and nobody is caught up on those.
Okay, so let's get back to your story then. And so you looked at all these recommendations and said, I know enough to not do this. So then what did you decide to do instead? Yeah.
So what I did, I mean, I got out my calculator and looked at, based on my weight and about a 2,000 calorie diet, how that would divide out into percentages. So, the recommended carbohydrate intake, it depends who you're looking at in terms of papers, but it's anywhere from 40 to 55%. At that time, I was told to eat 55% carbs, 25% protein, and 20% fat. So what I learned just, by self-monitoring my blood sugar and obviously having been trained as a physician was that what I needed was more like 25% carbs, if that. I mean, I dropped lower at times, but then I would have ketones. So I had a pretty balanced approach, but I did 25% carbs, 25% protein, and 50% fat. So pretty high fat diet.
And what type of carbs were you eating? And then where were you getting your fat?
Yeah, great question. I mean, because obviously not all carbs are created equal. So my carbs were really plant-based. So like a sweet potato or spaghetti squash, things like that. I still do that, right? Like I try not to eat processed things. And I think it's important when you talk about carbs and whole grains, even for somebody who is eating whole grains, maybe eating whole intact grains like quinoa is not going to spike the blood sugar as much as a not intact grain like whole wheat bread. I mean, I don't think of whole wheat bread as a whole grain really, but most people do, right? But it's processed. It's highly processed. So really it's like, I think intact grains is a better way to put it. I don't do tons of grains myself, but I think, some people would tolerate a little bit of quinoa or, maybe even like jasmine rice to a very small degree. So, but yeah, I mean, mostly if you have blood sugar issues, it's like plant-based carbs as much as you can.
Yeah, well, that makes sense. And the other unfortunate thing about, I think, some of the recommendations, not just for people with gestational diabetes, but type 2 diabetes, prediabetes, even type 1, they don't really differentiate between the types of carbohydrate. To them, carbs are carbs, and that comes right from the ADA, unfortunately.
Right.
And it really doesn't make a difference, according to them, where you get your carbs. It's, they will say maybe cut down on sugary drinks, but that's more just to cut carbs in general to an allowable range. But where you get it doesn't make that much of a difference. And of course, we know that food is way more than something you could calculate on a piece of paper. It's way more than calories. It's way more than macronutrients. There's so much more to food.
Yeah. It's so much easier to think of things as black and white, but it's never black and white. I mean, our bodies are so complex and biochemistry is so complex. There's no black and white, it's not calories in, calories out, of course, but yeah, it's interesting to see, how then food sensitivities play a role and different stressors play a role. And then, I mean, we talk about carbs too, and then we get down this rabbit hole of like, food sensitivities. We'll talk about that later, I'm sure. And, dairy, right? So like milk's a carb. I mean, some people think of milk as like a protein or something, but I mean, it's full of sugar.
Yeah, for sure. Yeah, let's talk about food sensitivities, because this is an area that I think is interesting. And we talk a lot on this program and in my other programs about stressors and going beyond the mental, emotional stress and looking at physiological stressors, which food sensitivities is one of those. It can trigger a stress response, which can have an effect on your blood sugar. Yeah. And I think you said that's something you noticed when you were dealing with your blood sugar during your gestational diabetes period?
Yeah, absolutely. I mean, what I've come to learn about myself is that I'm highly, highly gluten sensitive. So probably the most gluten sensitive person you've ever met. I mean, I won't even touch the stuff with like a 4-foot pole. So, I mean, I think that was a huge part of my underlying blood sugar response. I mean, what I see in patients, as I know you do, is there's this population of patients where it's not really a insulin sensitivity issue. It's a stressor. It's this underlying stressor. And I liked how you said, like, stressors are not always mental or psychological. Stressors are often very physical. So it's like this underlying physical stressor that's causing a blood sugar response. And you'll see these patients who now, I work with so many patients who are like me and are a very normal weight and, work out and eat healthy foods. And you would think they would never have a blood sugar issue, but underlying, some of these things, they have these underlying health issues that just haven't been uncovered. And the symptom of that is a spiked blood sugar, is an exaggerated blood sugar response. So yes, I absolutely realized like food sensitivities played a big role for me.
Is that something you noticed? You talked about picking up a glucometer and some test strips and kind of monitoring yourself. Do you see a direct connection with certain foods and the food?
Boy, I don't know. It's a hard one to say because I've never, I mean, if I eat gluten, I'll like be vomiting. So I didn't really check my blood sugar, like it's one of those responses. It's very easy to stay away from because I have a pretty violent response to it. But as you know, until you eliminate that food completely, you often have no idea how sensitive you are to it. Until you really get it out of your diet. So yeah, I mean, at the time, I don't know that I could directly correlate it, although I'm sure. I mean, I think it was more sort of just this like chronic low grade underlying issue versus an acute response.
Yeah.
But, as you get rid of that.
I wonder because, dealing with people with blood sugar problems day in and day out, sometimes their blood sugar just jumps up and it's really hard to sometimes pinpoint what exactly did that. And there's so many things that can affect it.
Yeah.
And I suspect that food sensitivities are one of them, but never been able to draw a real, strong correlation there. It's interesting.
Well, I think what you said initially was perfect. Just that it's just like, it is a stress on the body, and these underlying stressors are the things that spike blood sugar.
Yeah, absolutely. I think so too. What do you think are some of the most common food sensitivities that you see in your practice?
Yeah, I mean, definitely gluten, and then dairy, unfortunately, is a big one for people. So, I mean, there are so many people who are gluten intolerant. We've all seen this fad, but then yes, like dairy is up there as well. So definitely those two. Unfortunately, for some people, it's eggs. I think eggs are great because, there's a ton of choline in the yolk and nutrients, and I love eggs, but unfortunately people have sensitivities to those. I mean, sugar is a big one, just like white sugar. A lot of people are sensitive to that. So those would be like the top three are dairy, gluten, and unfortunately eggs. I don't take eggs out a lot unless there's pretty good evidence that it's a problem. But
okay. And what do you think the best way of learning about your food sensitivities would be? Is obviously not everybody vomits after they eat.
Right. Yeah. Obviously it's not so obvious. And really that reaction didn't come until I was, completely off gluten for like at least a year. I mean, now if I accidentally get exposed to it, that's the response. But that was not my initial response. I mean, I would accidentally slip up and like eat something with gluten and think like, oh, oops, like, did that give me like a GI issue? I didn't really know for a while, but, so testing for food sensitivities is a really interesting thing. I mean, I talk to my patients about this, and I offer food sensitivity testing through a couple different labs. But we have to remember food sensitivity testing isn't perfect, and so it's when do you do it? So for somebody who is already on an elimination diet and has taken out a lot of foods from their diet, it tends to be less helpful, because if you're not eating foods and you test for them, they're not going to come up as positive. So you just have to interpret them with some degree of caution, but I do find them as a helpful guide. So it tends to be most helpful, I've found, in the patients of mine who are really eating a variety of foods. I mean, they're eating a lot of foods. They haven't eliminated things from their diet. And then you can sort of look at these categories and see if everything lights up in the dairy, but it's low grade, there's probably an issue. If something lights up under egg or gluten, there's probably an issue. But, you just have to interpret it with caution. In the case of egg, that like, is it cooked egg or is it raw egg? I mean, those are different things. The proteins change. And so just there are little details to pay attention to. But I do find that food sensitivity testing is a helpful guide. And then, of course, an elimination diet. So I put a lot of my patients on something similar to like a Whole30 diet, where you take out most of the offending foods. Of course, people are sensitive to things like legumes and alcohol and all of that. And so you take off all those foods and then slowly add them back one at a time and see if you have a physical reaction to them. But really, I think it's important to take them out for at least 4 weeks.
So let's say we do 30 days with no grains at all, no gluten, no dairy. Let's say we get rid of eggs as well. And then we do no beans or legumes, and maybe we get rid of, soy would be in there. We get rid of soy.
Right, soy.
We get rid of corn, which is a grain, but a lot of people forget it's a grain. So we get rid of that one also. Where we've covered, I think, the most common food sensitivities there. And we do that for 30 days, and then we start to reintroduce these foods. What are some of the physical signs and symptoms that people should look for to, as clues to whether they might be sensitive to a food?
So, I mean, most people think about gastrointestinal issues. So loose stools or even constipation, bloating, that kind of thing, vomiting. I mean, if it's pretty severe, but it goes way beyond that. Skin rashes, any histamine sort of issues, hives, itching, that sort of thing. Also mental issues. I mean, I see people who have psychological issues with gluten. I mean, it makes them feel depressed or emotional. And some people who feel dizzy. I mean, it can affect your vestibular system for some people. What else? What else am I missing? What other kind of reactions do people have? Headaches is a big one. Stuffy nose is a big one too. Congestion and mucus production. That's another big one I hear.
Yeah, especially with dairy.
Yeah, and sometimes it's like joint pain and swelling and just this overall inflammatory state.
Yeah, sometimes you can just see it in the mirror too. Like
totally.
A little puffy or those dark circles under the eyes a bit.
I talked to my patient yesterday, and we had a video appointment. I'm like, you look different, like younger. I don't know. You look better, because he's like taking out beer and bread, and he looks good. And yes, it's hard to take that out of your life when it's part of your like social fabric, right? But there's some decent substitutes, and you can see it. Yeah, you can absolutely see it in the mirror. I mean, I can see it in the mirror. If you look back at pictures of me from 15 years ago when I ate gluten and I had no idea that I was sensitive to it, I was just puffy. I mean, it was just puffy.
Yeah. And so much of health is fairly subtle. I mean,
Right.
when you experience it, there's a huge difference between, feeling like a 7 or an 8 or a 7.5 or a 9, on a scale of 1 to 10, feeling like truly like yourself. And sometimes it just feels like that veil gets lifted and like life just seems different. That's hard to describe. It's hard to measure, but
it is.
You go through that process.
It's easy to see, right? Like you can totally see it on people, but it is such a good way to describe it as like lifting the veil.
Okay, great. You mentioned fats earlier, and I want to circle back and talk about fats because I think not only for adults, but for a developing fetus and a baby, especially for moms, again, going back to gestational diabetes, a low-fat diet is recommended, but babies need healthy fats, right?
Oh my gosh, totally. Fat's like one of my favorite things to talk about. So having adequate fat in your diet is important for any pregnant female, for baby, but also for mom. So I have another quote. This one is from diabetes.org. It says, making healthy food choices. Follow simple daily guidelines like eating a variety of foods, including fresh fruits and vegetables, limiting fat intake to 30% or less of daily calories, and watching your portion size. Healthy eating habits can go a long way in preventing diabetes and other health problems. And this is in their like section on gestational diabetes. So, I mean, again, it's like back to the carbs thing. Like if you're not eating fat, what are you supposed to eat? I mean, you can only eat so much protein, and we're trying to limit carbs. Like, well, what do you fill it with? Right. So like I said, I was eating at least 50% of my calories from fat, but looking back, that was a really good idea. So some specific types of fat, particularly DHA and ALA, those are especially important during pregnancy because they support the baby's brain and eye development. So we know that. We know, most good OBGYNs are recommending patients take fish oil. That's another issue. You need to make sure your fish oil is pure and, low mercury and all of that. But, but those fats are really important for baby's nervous system to develop. But, fats are also helpful for the placenta and other tissue growth. They're shown to prevent preterm birth and low birth weight. And then when you talk about mom and mom's mental health, fats are really associated with psychological well-being. And so I think they play a big role in preventing postpartum depression and issues with mom. I mean, during pregnancy, as we know as mothers, it's like a very taxing time. I mean, all of our resources are going to baby, and baby is, evolution is such that like baby pulls the resources first, and then we're left with nothing. So if you don't have enough fat on board, baby's getting what baby can get, and then mom is going to be totally deficient, right? So, I think a lot of healthy fats are important. So the type of fat I think is important to talk about too. When we talk about DHA, that's a omega-3 fatty acid, which is a type of polyunsaturated fat. So that's going to come from cold water fish, another where do we get healthy cold water fish that is low in mercury? That's a whole other issue. For some people, they can convert flax and walnuts into omega-3s or into DHA specifically.
And that's the ALA, the alpha-linolenic acid that you mentioned.
Yes. And that goes back to, it's interesting if you look at genetics and you look at something called nutrigenomics, which is the study of sort of how your genes react with react with food and what kind of nutrition would be optimal for a person. But looking at nutrigenomics during pregnancy or any time is super interesting. So, for some people, there's a genetic challenge with converting the alpha-linoleic acid to DHA. So, but for some people, they do that great. And so eating a lot of walnuts, hopefully they convert to DHA down the line.
And then what about, how do you feel about saturated fat, particularly plant-based saturated fats like coconut?
Okay. So that's like a big thing, right? Saturated fats, again, back to nutrigenomics. Like at one point, I sort of thought everybody did great on saturated fats, but I think there is a proportion or a population of people who don't do as well with a high saturated fat diet and are better with the polyunsaturated or the monounsaturated fats. But in general, most people do well with saturated fats, and they make up close to like 50% of our human cell membranes. They're a really important energy source for a rapidly developing baby, right? So like what else, if we're making a bunch of cell membranes, we need a lot of saturated fat. But I do feel like, as you said, eating them from plants is very different than eating them from animals, and they're metabolized differently. So, optimally, if you're eating them from plants, that's great. I mean, I think a lot of people though do just fine with animal-based saturated fats as well. I mean, I'm fine with those. I mean, but there definitely is a population that I see who are not. And it's interesting to look at their lineage too. Like I have a patient who's Scandinavian, and she really doesn't tolerate saturated fats very well. They really spike her blood sugar, looking at particle size and things like that. But that's outside of pregnancy. I mean, I think inside of pregnancy, most pregnant females are young and we're not talking about cardiovascular risk factors. So yeah, I mean, I encourage a balance of preferentially plant-based saturated fats, polyunsaturated omega-3s, and then of course the monounsaturated. I like to go pretty heavy with monounsaturated fats like olive oil, avocado oil, olives, nuts, that sort of thing.
Yeah, for sure. And if you look at breast milk, I mean, that's a
totally
way to view it also. And breast milk is obviously a high fat food, and that's what babies are supposed to be eating, right?
Yeah. Have you ever seen express breast milk like in the fridge?
Yeah.
Yeah. I mean, it's really interesting. You can see this layer of fat on top. And I will say just personal, we're all sort of scientists on ourselves, but like with my daughter, I was actually healthier with my first pregnancy than I was with my son, who is many pregnancies later, but my second born child. And you could see it in my breast milk. Like I had a lot of fat on the breast milk with my daughter, and then it was less obvious with him. And so it's interesting, like breast milk is a high fat food. Babies need high fat, but it's also like looking at breast milk quality is reflective of mom's health.
Wow. Fascinating.
Yeah.
Well, let's shift gears and talk about pre-pregnancy and fertility, because that's a huge issue as well. And
yes,
I think blood sugar also plays a big role there.
For sure. I mean, I think, we have this underlying sort of health crisis. I feel like a lot of females I meet, moms, people who want to become moms, have this underlying issue with their health, and they're just not able to pinpoint it. But so many people come to me or send me text messages or send me messages and say like, I know something's wrong. Can you help me figure out what it is? And I think it's really important that we listen to that little inner voice that says something's wrong, because I think a lot of times what's happening is people look pretty good, so their health gets dismissed because they're not having an acute issue. It's just this underlying chronic low grade thing that's happening. And so anyways, I think this like underlying chronic low grade thing that's happening in our world is affecting our health and thus affecting our fertility. So it makes perfect sense if you think about it. Like if we're not in a good healthy state with our body, why would we want to procreate? If you think of it from an evolutionary perspective, like that it doesn't make sense. So I think it's really important for women who are struggling with either recurrent pregnancy loss as I did or infertility, that they really look at underlying health issues and address those before they get pregnant.
What would some of those be?
Yeah. So, I mean, a big one is toxicity. There's glyphosate or Roundup in our food, on our plants. I mean, people are spraying their homes with this stuff. That's just one of them. I mean, we rub toxins on our body as makeup products and personal care products. We breathe toxic air a lot of times. I mean, for some people with infertility issues or recurrent pregnancy loss, it's mold and mycotoxins in a home. I mean, there's so many different toxins in our world, and there's only so much we can do to eliminate that. But it's a pretty big one. And most people who are wanting to have a baby are thinking about those things. A lot of them are eating organic foods. And I think that's really important. But sometimes you have to go further and really investigate what it is and look at your environment. Water is another big one. Of course, it's like air, food, and water, right? So what's going on with your air, food, and water? Is it clean? So toxins are a big one. Blood sugar, as you know, is going to cause hormonal disruption. That ties me back into not only hormones, but thyroid, which is obviously another hormone. So I see so many people who are deficient with their thyroid hormone. They're just suboptimal, and they're not like frankly hypothyroid, but sometimes they are. And I find a lot of women, I check pretty much all my patients for thyroid antibodies, and I unfortunately find a lot of people who have Hashimoto's and I had no idea they did, right? Because their TSH is pretty normal-ish. Like maybe it's 3, but it's certainly not something that most physicians address. And so there's this underlying thyroid issue, which it goes back to a lot of things. If you're one is autoimmunity, but some people just have a low thyroid function for other reasons, toxins, infection, stress. Another big issue I think with fertility is the gut. If you don't have a healthy gut or you have intestinal permeability, leaky gut issues, that's going to affect fertility. There can be these underlying chronic low-grade infections in the gut, which are just perpetuated by food sensitivities. And it's this like vicious cycle, right? And then, micronutrient deficiencies. I think micronutrient deficiencies play a role in a lot of health issues, if not all of them. I mean, they're playing some role there, and are only exacerbated by things like gut infections because absorption is an issue. And then, of course, that goes back to what are we doing with our food supply and the nutrient density in our foods. So those are just some I can pull off the top of my head, but some that I focus on for sure. I mean, it's it depends on everybody and their environment and their risk factors and
yeah, well, I mean, you can see how many people are dealing with these things and maybe why we have the problems we do right now with fertility. It's
totally.
No.
Yeah.
Excellent. Well, this has been fantastic, and I could probably talk to you all day, but we're going to get close to wrapping up here. So, Christine, I want to give you an opportunity to let people know how to find you or to share kind of what you're doing right now. So if people want to get more information about you and your practice or the information that you have available, what's the best place for them to do that?
Yeah, the best way is just, my website. It's drchristinemaren.com. So it's Dr. Christine is with the CH, and my last name is Maren, Maren.com. So if you go there, there's plenty of information and lots of blog posts on there. And pretty soon here, I'll be publishing some more information about, healthy pregnancy, certain supplements I take during pregnancy and that sort of thing. So yeah, find me there or find me in Colorado.
That's right. All right. So I'd love to ask all my guests 3 questions here at the end. And the first one has to do with your work and the impact you're trying to make on the world through medicine and through your practice. So if you had a quote or some sort of statement that best characterizes or represents your work, the legacy, so to speak, that you'd like to leave right now, what would that be?
I think a lot of it is just listening to your inner voice and trusting your intuition when it comes to your health. I think so many women I see and so many patients I see have been dismissed and told it's in your head, go see a psychiatrist. And I think that's a pretty offensive thing. So I think it's important that people really trust the inner intuition. I had that once. I knew at a certain point in my life, something's just not right. And I had a lot of people trying to reassure me. Everything's fine, but I just knew something's just not right. And indeed, something was not right. So trust yourself. Powerful
statement. If someone came to you, let's say a friend or a family member, newly diagnosed with type 2 diabetes or even gestational diabetes, and was coming to you for advice, maybe not even as a doctor, but just as a friend or family member that has a lot of knowledge in this area, in just a couple minutes, what would you tell them to do?
Check your blood sugar. Do a fasting blood sugar and then a 1 to 2 hour postprandial blood sugar check, and do it a lot. I think it empowers people, and it provides like immediate feedback. So you get this very individualized information on what certain foods are doing to your blood sugar, because certain people, people are different. I tolerate potatoes fine. Some people don't,
studies have shown that self-monitoring is the greatest key to success with compliance to any program. So I think self-monitoring is really important. Great advice.
Yeah.
Lastly, and this is a kind of a bigger, broader question, but if you found yourself sitting around a large table in a boardroom with 20 of the world's leaders, the industrialized world, and they, created this sort of summit of leaders to solve the diabetes epidemic, and they brought you in as an expert to share advice, what would you tell them to do?
I would say go back and look at your nutrition recommendations right away. I mean, I think that's the biggest thing. Like even the broader audience, people who are not who don't know to come find you and listen to your podcasts and read our blog posts and things like that. I mean, they need to hear that whole grains are, not the key to health. Like, things have changed. We realize that's not what we're doing. It's not the right thing for our body. So this very simplistic approach is just like change the dietary guidelines so people have a better shot at it. And
if you could have your influence over the dietary guidelines,
I would say liberalize fat, especially monounsaturated fat and omega-3 fatty acids from clean sources. And, eat clean protein and plant-based carbohydrates. Not all carbs are created equal. Like, that would be my little snippet if I had 30 seconds.
Awesome.
Yeah.
All right, Dr. Christine Maren, thank you so much for spending this time with us.
No, it's my pleasure.
Yeah, I just want to honor you for following that inner voice and, being brave enough, knowing what you knew at the time to go into medicine and decide to change it from the inside. I think that's it's not for the weak of heart, right? I can share a gift with your audience. Yeah, that'd be great.
Which is particularly relevant for women who are, pregnant or wanting to get pregnant. But if you go to my website, drchristinemaren.com/gift, there is a free ebook on there, 12 ways to detox your home. So it's, basically the 12 sort of top ways to get the toxins out of your house and sort of, it's a good place to start, especially for people who are sort of just going down this path and don't, it's all very overwhelming. And I did it in 12 ways because I consider it like you change one thing every month and within a year, you'll have a pretty clean home.
Ah, nice. I love that. So drchristinemaren.com/gift.
That's it.
All right. Well, Christine, thank you so much for being on the Mastering Blood Sugar podcast and sharing this time with us.
It was my pleasure. Thanks, Brian.
And thanks to all of you for subscribing and for tuning in and listening to the Mastering Blood Sugar podcast. This is Dr. Brian Moll, the diabetes coach, and I will be back next week with another expert interview. Take care, everybody.